Now, another kind of crazy question, and obviously this has been well thought out. What about people who have baldness up top but still have like axillary or pubic hair? Like, is why not use those? I'm sure. Is it just weird because you'd have like pubic like hair growing on the top of your head?
So we could do a whole podcast on alternative sources of donor hair. And, first of all, if we're running out of hair from the scalp, it's an important concern, right? If there's a lot of scar tissue, somebody's had some old procedures and they have visible scars and they don't have good coverage, what do we do? Well, yeah, we can go to alternative sources of donor, but before we hit the pubic hair, let's deal with the beard first, okay? Um,
Yeah.
so the beard is actually very robust. It grows very well on the scalp. And I'm amazed that like every single week we're doing beard to scalp harvesting and plantation. So it's a very, very big part of my practice. I've been doing beard to scalp for, I think, well over 15 years. 2010 or earlier was our first beard to scalp harvesting. And it works amazing. But
Nice.
it does have a little bit different texture,
Right.
sometimes a little bit different color. So we have to carefully use it. Maybe it's not appropriate for every patient in the hairline, but kind of peppering in between. Think of those oak
Mm,
trees scattered in between the birch.
yeah.
It can be a miracle cure for many patients and a huge lifeboat for those who thought that they've been turned down because of lack of donor hair.
Nice.
So, but we could do a whole podcast on other alternative sources of donor hair. And you brought up axillary hair, right? I've done
Hmm.
axillary hair to scalp, although it comes with the sweat glands. So, should you be
Right.
using deodorant up there? I don't know. That was in the consent. We've done pubic to scalp hair, and see, Saturday Night Live thought that they were doing something funny, but art sometimes imitates life. We do
Yeah.
pubic hair transplants in some cases, and it's interesting, what we get asked to replace and restore sometimes.
Hmm. Now, without necessarily needing to get into the specifics, like how much do these things kind of like cost people who are interested in pursuing this? Because I know there's multiple people listening to this right now and they're like, I really think this sounds great, but I think this is going to be like crazy expensive. And like, how do you talk people through that? Because like at a certain point, you could say, what price could you put on your well-being and your confidence in your life? And again, I'm sure there's also like financial concerns that people have. So how do you speak to patients about that who are interested but maybe concerned that this might be like crazy and out of reach for them?
Sure. And unfortunately for some, it might be out of reach.
Mm-hmm.
The good news is that practices like mine, if someone has been injured in an accident, and especially military veterans, I'm very keen on doing those cases pro bono. If they've had some accident while serving this great nation, in combat or otherwise, or in preparation to protect and preserve our freedoms, then I encourage those folks to reach out and let's see if there's something we can do. I can't take, every single one, but
Yeah.
I have a 501c3 called the Bauman Philanthropic Foundation that handles that.
Nice.
Um, One of our even scalp prosthetic devices, we have experts in the practice. We've been using cranial prosthetics for those who cannot undergo hair transplantation. And sometimes those are provided pro bono as well if it's a serious injury like a burn victim. We had a woman who, as a child, was burned in a terrible kitchen fire, and she was wearing a wig her whole life. And we were able to get her a cranial prosthetic. Um, but so those cases are difficult to run through the beauty budget.
Yeah.
Obviously, there are many different types of providers out there, just as it is for hormone optimization therapy and longevity. You can go down and get the guy off the bus bench, 1-800 low T, or you can go to someone, who's world renowned in the world of hormone optimization, and you could potentially be paying 6 figures a year to be under his care.
Hmm.
So the good thing about hair is that if you start early enough, the numbers are low, right? So what does that mean? A prescription medication could be $80 to $100 a month, which is nice because it will reduce the side effects from the regular medications that you might get at the pharmacy or in the supermarket, let's say in the Rogaine bottle. Laser devices on the market in Amazon, you're looking at $600 to $800 for one of those devices, but you're going to be hamstrung by the portability, the power, and the more medical grade devices are going to be in the $3,000 to $5,000 category. The top end would be like the turbo laser cap, which is completely portable, rechargeable, hands-free, size adjustable, lifetime warranty. But that's, a good quality laser is a lifelong investment. You're going to have that forever, and hopefully you get
Right.
one that has a lifetime warranty. just like a TV, you want to get something that's going to last, right? It's a piece of
Yeah.
electronic equipment. In terms of injectable treatments like the regenerative medicine therapies, those therapies start typically around $3,000. We have a newer technology that's called TED, transepidermal delivery. That's an in-office treatment with no needles, no downtime, that has an effect similar to PRP. That requires a few treatments. So a package of that is comparable in cost to a PRP treatment. So those are going to be in about the $3,000 category. And they jump up from there with PDO threads. You're maybe in the $5,000 category. Exosome therapy, maybe in the $8,000 category. And then you get into hair transplants, which can range depending on the session size. Anywhere from $10,000 to even $50,000 for a procedure, depending on the size and the scope of what we're doing. And how we're getting the hairs. So there's a set fee per graft. If we can shave your whole head, then it's faster, right? So there's a little bit of a savings there. If you're a high profile individual, you're front facing, C-level executive, you're an actor, politician, entertainer, you can't change your hairstyle, you have long hair. We can take the hair follicles without shaving, but it takes longer and you don't get as much hair. So that procedure is a little bit more expensive. That's like that's the ultimate, that's the 5-star thing, VIP thing. So it can range depending on how much grafting you need. But that's why I encourage anybody who's out there with a little bit of hair loss or a lot of hair loss, let's get to the bottom of the situation. Let's figure out what you need to get the job done. And that way we can come up with a good budget for you, a beauty budget, if you will, and how to apply that. You may be better off dedicating the dollars from PRP into a hair transplant, or if you're young, maybe vice versa, dedicating it more now to the preventatives so that you don't need as much transplants later on.
Nice.
So that's where the consultation really gets, down into the weeds in terms of what a patient needs and wants and what fits into his or her lifestyle and their risk tolerance.